Preparations have begun in several parts of the country for the upcoming festival season. Union Health Minister Dr Harsh Vardhan, however, has given people a bit of a reality check. Yesterday, he said that there's no need to congregate in large numbers to prove your faith or your religion. You can pray to your gods and celebrate at home with your family. He's urged the citizens of the country to celebrate festivals indoors. He's also pointed to the possibility of an increase in coronavirus cases come winter. Remember, the country has crossed the 70 lakh mark in terms of overall cases of the coronavirus. And it is, with the upcoming Durga Puja, Dussehra, Diwali and Chhath Puja, which is around the corner, there is now a serious concern about the COVID number spiking as people will step out to celebrate these festivals. So this, of course, has been an advisory yesterday by the Health Minister himself, who's urged people to stay at home. Yet, what one is seeing happen is that there are still states and governments that have allowed for puja pandals, for instance, to be set up, for festivities to be celebrated in the public. So is the Health Ministry saying one thing and is a whole different thing happening on the ground? Let's first listen in to what the Health Minister said.
As an individual, as well as the Health Minister of the country, my dharma is to protect my people, to save lives and not destroy. No religion or God says that you have to celebrate in an ostentatious way, that you have to visit pandals and temples and mosques to pray. There is no need to congregate in large numbers to prove your faith और योर रिलीजन. मैं तो यही चाहूंगा कि लोग सभी त्योहार अपने परिवार के साथ मनाएं.
All right. So this, of course, is the big development that we're tracking. It's a very concerted, very conscious statement that's been made by the Health Minister when he's urged citizens to stay at home, celebrate festivals at home. But then why is it that puja pandals and celebrations, etc., are being permitted to take place altogether? Is the Health Ministry saying one thing and is a whole different thing happening on the ground? We have Raghav Chadha and of the Aam Aadmi Party and Dr Romil Tikku, Associate Director Internal Medicine of Max Healthcare, joining us. Thank you both very much. Dr Tikku, I want to begin by asking you, the Health Minister yesterday has said two very important things. One, of course, that one can see a spike or is expecting to see a spike in coronavirus cases with the onset of winter. And the second, he's urge citizens to stay home and not step out or into public places this festival season.
Well, there can be a huge spike in numbers because of the winter setting in, because of the pollution in Delhi. And when we are part of these huge public gatherings, religious or otherwise, there's always a chance of it becoming a ground for spread of infection. And the people who attend these gatherings, they can become super spreaders and they can spread it to everywhere, wherever they go, workplace or at home. And if they have vulnerable people at home, they can have complications. So what I would say is that this year celebration should be low-key. You can always celebrate, you can pray from the comforts of your home with your loved ones, with your family, but don't be part of these huge public gatherings because these gatherings can lead to spike in the numbers and we have to learn from our mistakes. This is what has happened in Kerala.
Yes.
Post-Onam, these gatherings has led to a huge spike in numbers, and so for Maharashtra. Even Maharashtra is struggling now that the numbers have gone down, but earlier post-Ganpati festival, the numbers did spike up.
Yes.
So Delhi is no different, and with the kind of problems that we have in winter, the temperature and the climate and then the pollution and the vulnerable population, especially the ones who have chronic lung problems, they've already started coughing and started using their inhalers and they're going to be in trouble. So even the children and the vulnerable population. So what I would say is that stay away from public gatherings as much as you can. We know we have to celebrate, we have to pray, but we can always do it from our home and avoid these gatherings.
Well,
that's what I would advise people.
That is advice that I hope that viewers pay heed to, whether it is what the Health Minister has said or what you're saying, Dr Tikku. But Raghav Chadha, if I can come to you, in Delhi, the situation is particularly vulnerable given the fact that there's an extreme winter. It's extremely cold in Delhi and several parts of northern India. we're also heading into the pollution season. At a time like this, is it wise for the Delhi government to have allowed for, puja pandals or Ram Leela to happen? This permission has been granted yesterday by the Delhi government.
Yeah, so first of all, there is a guideline, a set of do's and don'ts, a broad structure, a skeleton that is on a monthly basis put out by the Ministry of Home Affairs, which has the effect of the Disaster Management Act. This then is adopted by all states. Each state has little legroom to tinker with it. And it is in consonance with what has been issued by the Ministry of Home Affairs, Dr. Harsh Vardhan's own government, that the government of Delhi has put out certain do's and don'ts and has put out its own set of circulars and guidelines. Now, food stalls, melas, Diwali melas, fairs, etc., of course, have been outrightly banned. However, in a very careful way to strike a balance between one's religious sentiments, beliefs, and faith, and at the same time protecting their health from this raging pandemic, certain standard operating procedures have been laid down that in the event that people do wish to have some, Durga Puja or some sort of festivities, then in that case, a very strict set of norms need to be complied with. The district magistrate's permission is required. A nodal officer by the government of Delhi will be appointed at each event site. The DCP's permission is also required. Yes, and the entire, Rishika, just let me finish. The entire event will be videographed. The entire videography of the event will be submitted to the government of Delhi, that is the DM's office, on a daily basis. And if there is any incident of non-compliance of these norms, the permission to hold that event will be immediately revoked.
No,
so these are the standard operating procedures.
All of that is appreciated, and I think those are rules and regulations that have been imposed even as we went into several phases of unlock. It's not like there are no rules and restrictions in place. There are, of course, COVID-19 restrictions in place. The question is that, at a time when we are only looking at essentials, when every doctor, every health expert is advising people to only step out, only go out to the market or to work if it is absolutely essential, stay at home as much as you can, why give people the option? Why allow for puja pandals? And this is not just happening in Delhi, it's also happening in Bengal. It's happened in Kerala already. We saw muted Ganpati celebrations in Maharashtra as well. So I'm not targeting one particular government, but then are we saying one thing and doing a different thing?
So Rishi,
are we not trying to appease people here?
Right. So as I said at the outset, why every state is doing this? Because a broad set of guidelines, the skeleton, has been put out by the union government. And the state governments have chosen to adopt what has been put out by the government of India. And therefore, you see whether it's an Uttar Pradesh government or Bengal government or Delhi government, they've tinkered with it slightly and put out their own set of standard operating procedures, do's, don'ts, so on and so forth. Now, look, I do understand that we're in the middle of a raging pandemic. And I also do understand that these congregations and these, these big prayer meetings, etc., could probably, result in some sort of spike. And therefore, what the government of Delhi has done, of course, apart from making an appeal to the people to not congregate, to not step out and go to these events to prove their beliefs, but at the same time, a very limited legroom has been given to some people to organize this event, and strict standard operating procedures, whether it's masks, social distancing,
but I mean,
hands, etc., will be complied with.
The Delhi government has taken a very welcome stand when it comes to schools not reopening. And those, of course, there are central government guidelines for schools to reopen as well. So, why not take a stand and not give people the option? Let me get in Dr. Tikku back into the conversation. Dr. Tikku, do you believe that the option in itself should be eliminated?
This is an option. This is an option. I mean, it's not that one is throwing, trying to force
I know
somebody
there are
to
no
conduct this
invitations
event.
being thrown around, but if you know that there is a puja pandal in the vicinity, for people who are dealing with what we call COVID-19 fatigue, if people do venture out and do step out, they are exposing themselves to risk.
Well,
Dr.
by the
Tikku, what would you like to
logic,
tell viewers?
By the extension of that logic, we should go in a lockdown.
Okay.
By the extension of that logic, we should go back to a lockdown phase where everything should be shut and we should be confined to our homes. Lockdown is not a permanent solution, Richika.
Okay.
To say that, to my mind,
smart to be
a perpetual state
festivals?
of lockdown is inconceivable.
Okay. Dr. Tikku, which way would you weigh in?
Well, I'm not too sure how we can follow these SOPs. You look at the roadside, people are not even wearing masks. What do you expect from these people? Do you really think they'll follow the SOPs and everything will be followed in order? I have my doubts. I really don't know.
These
I'm
people,
not saying that eliminate it, but yes, there has to be some sort of a way of dealing with it. There has to be a limit, but how much you can handle that, will you handle the crowds? And in these gatherings, you can't really do much. Who's going to follow the SOP? Let's be very practical about it. So the way things have happened in Kerala and Maharashtra, as I said earlier, it's very difficult. Once you are there, and one person gets it, he gives it to every other person, and then the spread happens. And that's how
Also,
it is.
Dr.
I would
Tikku,
say,
may I?
yes, Raghav, I'll come to you in just a bit. Dr. Tikku, I also want you to comment on, why the situation in northern India, we're talking about Delhi here, of course, is perhaps a little more tricky, a little more scary. We've had healthcare experts here on NDTV. The health minister himself yesterday in that dialogue, has said very categorically that one can anticipate a spike in COVID-19 numbers come winters. There's also an air pollution problem which is likely to compound the problem. Are we heading into some very scary times, Dr. Tikku?
of course, yes, we have to be extremely careful, especially in Delhi with the winter setting in, and you know what happens during the season every year.
Yes.
There will be a spike in pollution levels, and with the numbers going up, we'll be in trouble. It might just overwhelm the healthcare system in Delhi, which hasn't happened till now. So in North India, we have to be extremely careful, especially in Delhi,
Yes.
with the pollution spiking up, with the winter setting in. And with these public gatherings, we might have a huge spike in numbers, and then we'll be struggling again. For the next 2-3 months, I would say the celebration should be low key. And there's always a next time. We can do it next year, or we can celebrate from home.
Yes.
But I'm not too sure how we're going to handle these gatherings. I would still say in North India, during these festival seasons, one has to be extremely careful, avoid these gatherings, or maybe not allow them. It's for the government to decide.
Yes.
But this is my personal feeling that this might lead to a spike in numbers, and then we might be struggling with it. We've done well till now, so let's not get complacent.
You raise a very important point, and let me ask Raghav Chadda that question. Are we risking once again overwhelming our healthcare system? We have seen a turnaround happen in Delhi. We saw a huge dip in the number of cases. So there has been a lot that the government has done to manage this crisis. Are we risking undoing the good that we've done so far? Raghav Chadda.
Look, first of all, the situation in Delhi, Rishika, is very much under control. The positivity rate is less than 5.8%. The mortality rate is less than 1.4%. And the rate at which the recovery rate is increasing, it outdoes the infection rate, and therefore we're in a comfortable situation. There are ample number of vacant beds, and the healthcare system is abreast and willing to cater to any sort of eventuality. Now, I do not agree, and I in fact take strong offense to what the doctor said, that what do you expect from these people? Will these people wear masks? While I do agree that yes, a sense of wariness has set in. Yes, there is lockdown fatigue that some people are experiencing, etc. But to call them these people is something which is a bit too harsh, and I would request the doctor to avoid such phrases. Number one. Number two, I am also not quite sure whether the doc has actually read the standard operating procedures or not. It's actually, quite frankly, a very strict set of guidelines where permissions will be revoked if the standard operating procedures are not followed. So what I'm trying to say is that yes, the government, I mean, I can argue both ways, but what this government is trying to do, Rishika, and all governments in that sense, to strike a careful balance between one's religious sentiments, beliefs and faith, and protecting their health.
Well, one really hopes for all our sakes, Raghav, that the government is actually able to strike that balance. Meanwhile, there are healthcare experts, including the health minister, the doctor here on the broadcast, who are advising people to use their own discretion on whether they consider it safe to step out or not. So it is, of course, the responsibility of each individual as much as it is of the government. Appreciate you both for joining us on this extremely important conversation.